Now let's talk about Chapter 4, Population Health Education. The need for health professions education reform. The IOM, in its report on health professions education, has provided compelling evidence that our current approach to educating health professionals falls woefully short of preparing individuals to address the central needs of a healthcare workforce in a transformed delivery system. Failure to alter health professionals' education remains an obstacle to changing healthcare delivery and improving the health of the population. Flaws in health professions education both reflect and contribute to the failures in our delivery system. Traditional education for clinicians in all disciplines focuses on acute medical condition and fails to incorporate the principles of population health and prevention. Education reform will play a key role in transforming the nation's healthcare delivery system. So right now, the way the current education is trained on is to look at those individuals that come in, let's say, to the emergency room for that one acute medical condition, and that's what they're focusing on. Instead of focusing on the principles of a population health and prevention as far as going out to the communities, going out to certain areas and letting them know how you can prevent these situations and these illnesses before they come on. Failure to fundamentally alter health professions education will constitute a profound obstacle to realizing actual transformation of healthcare delivery and improving the health of our population. New approaches to education must include competence to deliver patient-centered care, perform practice-based quality improvement, work in interdisciplinary teams, navigate growing bodies of information and new technology to employ evidence-based practices, utilize information technology in clinical practice, demonstrate cost awareness, and apply population-based approaches to improve health on a population level. Education for clinicians traditionally centers on the medical condition or conditions acutely affecting individuals and fails to incorporate principles of population health and prevention that are necessary to achieve a larger impact on our nation's health. Health professions education must be fundamentally redesigned to integrate new skills and approaches that support population health. Education reform will play a key role in transforming the nation's healthcare delivery system. Education for health professionals needs to expand beyond the traditional biomedical focus and integrate new skills and approaches that support the health of populations. Reforming health professions education requires a system-based approach rather than adding more content into an already overcrowded curricula. The IOM proposes a core set of competencies that all health clinicians should possess, regardless of their discipline, to meet the needs of the 21st century healthcare system. These core competencies include provide patient-centered care, identify, respect, and care about patients' differences, values, preferences, and expressed needs to help relieve pain and suffering, and also to coordinate continuous care. Another core competency is work in interdisciplinary teams. This is also to cooperate, collaborate, communicate, and integrate care in teams to ensure continuous and reliable care. Another competency is to employ evidence-based practice. This is to integrate best research with clinical expertise and patient values for optimum care. Also to participate in learning and research activities. Another competency is to apply quality improvement. This is to identify errors and hazards in care, to understand and implement basic safety design principles, as well as to continually understand and measure quality of care. And then finally, the last core competency is to utilize informatics. This is to communicate, manage knowledge, mitigate error, and support decision-making using IT. Just as healthcare delivery reform requires a system-based approach to improve the health status of populations on a larger scale, health professions education reform requires a system-based approach. Understanding and system-based practice entails that the physician residents demonstrate an awareness of and responsiveness to the larger context and system of healthcare. Also need to work in interdisciplinary teams, incorporate considerations of cost awareness, advocate for quality patient care, and participate in identifying system errors and implementing solutions. A systems approach to improving health education requires consideration of fundamental features of the educational system, including composition of population of learners, characteristics of the learning environment, organizational structures, as well as sources of support, such as institutional and financial. Although defining these major competencies and learning objectives is essential in curriculum design, a change in teaching is required to truly reform current health profession education and provide an understanding of the treatment of populations as well as the individual patient. A population health perspective is essential for reshaping the way in which health and healthcare are understood and approached, and more pointedly, the way in which the education of health professionals can be redesigned. A useful and dynamic framework designed to support this new approach to health professions education would be one that utilizes the concepts and methods of population health. Population health is defined as one that encompasses the ability to assess the health needs of a specific population, implement and evaluate interventions to improve the health of the population, and provide care for individual patients in the context of culture, health status, and needs of the population of which that patient is a member. Major concepts and methods employed in a population-based approach to health provide a structure for organizing and integrating key approaches into education. Now, here are some examples of developed frameworks in population health and strategy implementation. The AAMC Population Health Perspective Panel have come up with a Regional Medicine Public Health Education Center and then a Regional Medicine Public Health Education Center's Graduate Medical Education. Now, these RMPH-EC and the RMPH-EC-GMEs sites were required to partner with at least one state or local public health agency to help integrate population health, public health content into their curricula. The RMPH-ECs developed a list of competencies that all medical students should possess. This list can be found on page 70 in your textbook. And just to name a few, they need to assess the health status of populations using available data. They need to discuss the role of socioeconomic, environmental, cultural, and other population-level determinants of health. And they also need to identify quality improvement methods to improve medical care and population health. So here are some examples of frameworks in population health. The first one is quality improvement and patient safety. Now, there are three important recommendations from Teaching for Quality report. Number one is to ensure integration of the quality improvement patient safety concepts into meaningful learning experiences across the education continuum. Also, to expect all faculty to be proficient in quality improvement and patient safety competencies. Create, implement, and evaluate training and education in quality improvement patient safety for students, residents, and colleagues. And then a final recommendation would be for academic and clinical leadership should share a common commitment to the quality improvement patient safety and show the coalition of academic and clinical enterprises which shows excellent health outcomes. Another one would be interprofessional education and population health. Now, this intent of increasing health promotion, the intent here is to increase health promotion and disease prevention content in health professionals' education. Now, the IPEC, which is the Interprofessional Education Collaborative, comprises of Health Education Association from nursing, medicine, pharmacy, dentistry, and public health produced a report to define common language for interprofessional education and collaborative practice. So why was the IPEC formed? It was formed so that it can offer students the opportunity to address population health issues as members of teams that will equip them with an understanding of what each health professional brings to the care of patients and health communities. And then the community health workers in education, or the CHWs, are used to reduce disparities in healthcare and health outcomes. They are a systemized approach to providing self-management support for care of chronic conditions and navigation through a complex, disjointed healthcare system. They help patients to access primary care and preventative services, maintain healthy behaviors, and manage chronic conditions. Here are a few more examples of frameworks in population health. You've got Healthy People Curriculum Task Force, which is a clinical prevention and population health curriculum framework. This intent was to increase health promotions and disease prevention content in health professionals' education. Now, the framework consists of 4 components, which has 19 domains within the 4 components. They are an evidence-based practice, which evidence-based recommendations, implementations, and evaluations. Another one is clinical prevention services and health promotions, which are screening, counseling for behavioral change, as well as immunization. Another framework is health systems, where health services financing, health workforce, health policy, and process. And then the final component is population health and community aspect of practice, which helps with the environmental health, occupational health, and global health issues. The other example would be Community Campus Partnership for Health, the CCPH. This emphasizes the central value of incorporating the perspective of community partners and students into the development of the curriculum. This was designed for multidisciplinary health professions, faculty, and for community leaders interested in establishing partnership with leaders of health profession schools. This guide is also useful to faculty in other curriculum reform efforts and community activities. This provides tools to build and sustain partnership efforts, provide direction to students as well as residents. So, linking community-based education and service learning activities with initiatives that address the healthcare needs of communities can successfully convey fundamentals of population health while improving health outcomes. So now let's talk about the redesigning of the health professions education. Number one is the composition of the workforce. The composition of future healthcare workers, as well as geographic and specialty distribution of future healthcare professionals. These efforts are to eliminate health disparities, to improve access and quality of care, adapt to changing demographics, and address recognized professional shortages. So in order, we need to increase diversity. So diversity is associated with better access and quality of care for disadvantaged populations, greater patient choice and satisfaction, and better education experiences for students. Minority physicians are more likely to provide care for poor and underserved communities. Steps to ensure a more diverse pool of physicians and other health professions are pivotal for reducing health disparities and building a workforce that is attuned to the increasingly diverse population being served. We need to develop innovative methods to attract students from more diverse economic, ethnic, and geographic backgrounds to create a more diverse health professions workforce. So potentially have some loan forgiveness policies or something along those lines that aren't financially able to go down these health professions work path. We also need to increase the supply of primary care providers. So countries in which primary care is the foundation of the healthcare system achieve better health outcomes at a lower cost. But here, there's been a decline in the number of medical students choosing primary care specialties. So we need to maybe show a demand of the primary care. We need to maybe offer some rewards for choosing the primary care specialty. We need to maybe show some more prestige as far as primary care field, as well as we need to influence the medical school's faculty and curriculum to maybe emphasize primary care a little bit more as well. High medical school debt scares many medical students from choosing the less lucrative primary care field. Obviously, surgeons are probably going to make quite a bit more financially than a primary care physician would be. So we need to show some other incentives that would interest students, medical students, to go into the primary care field. So let's talk about some characteristics of the learning environment. First is the education in transformed models of care. So you've got the patient-centered medical home, academic chronic care collaborative, academic health department. Residents and other health professionals will best learn skills needed to provide high-quality care when medical education occurs in settings where such care is being performed. So for the patient-centered medical home, this is based on provisions of care that is accessible, continuous, comprehensive, coordinated, and culturally sensitive. So for the academic chronic care collaborative, this combines healthcare delivery reform with educational programs to improve the care of patients with chronic illness and to educate healthcare teams that provide care by facilitating the implementation of the chronic care model. And then for the academic health department, this is designed to strengthen linkages between academic institutions and public health organizations with the goal of enhancing public health education, training, research, and service. This has been described as public health equivalent of the teaching hospital found between medical schools and hospitals. And then the last characteristic of the learning environment would be education utilizing informatics. Many healthcare organizations are not equipped with advanced information systems. Even those that do have them fail to integrate the technology into the delivery of care. Education in community-based settings and practices. Now, here's a dilemma. Majority of healthcare in the U.S. occurs in community-based outpatient practices, while medical programs are largely based inpatient acute teaching hospitals and offer very little experiences in community-based medicine. Also, medical schools curricula places a major emphasis on delivery of tertiary services in inpatient settings to individual patients. Family medicine residency training is the only postgraduate medical training to require community medicine as part of its core clinical curriculum content. So the solution? Enhancing training and skills in non-hospital settings, such as maybe a skilled nursing facility, a rehab facility, or assisted living. This would be crucial in understanding population health. Education in and with interdisciplinary teams. There's a general lack of understanding among health professionals about what each profession does. The ability to work in interdisciplinary teams has been identified as a core competency for all health professionals. Only problem? Generally not educated together nor trained in team-based skills that would enhance their ability to work as part of interdisciplinary teams. And also, the lack of funding has hurt the implementation of interdisciplinary education as well. So for organization structure and sources of support, you have the oversight of health professions education. This is a lack of oversight across the range of education and between oversight processes, such as accreditation, licensing, and certification, within and among the various health professions. There has been a concerted effort to enhance communication and collaboration between disciplines, which can provide a critical change in competency development and education reform, which will improve population health delivery. Financing system of health professions education. This financing of health professions education is a key obstacle to education reform. And then changing the culture of organizations. Most students acquire their professional identities by observing those who taught them. Interaction with patients, staff, things like that. Reframing education through the lens of population health to emphasize the social, economic, and political aspects of healthcare delivery is an essential step in transforming professional values. So these next few slides will offer some recommendations as far as how we can improve the education to health professionals. Number one would be to introduce educational experiences that involve learners from more than one discipline. These experiences need to be led or taught by teams of interprofessional faculty. Also, rigorous evaluation of interdisciplinary educational efforts must be supported and include qualitative and quantitative elements. Next would be to introduce curricula explicitly examining the roles, contribution, and skills of different health professionals. As an essential competency, effective participation in interdisciplinary teams should be rigorously assessed. Knowledge and skills pertaining to interdisciplinary teamwork should be included in formative examinations. Students must participate in a community experience that addresses the need of a traditionally undeserved population. These experiences must be designed and conducted in partnership with people who live in the community and/or who work and/or live in the domicile that is the focus of the educational experience. Another recommendation would be to develop a population health steering group to formulate population health objectives and ensure that those objectives are routinely monitored and achieved. And then finally, educational research focusing on outcomes of population health curricula must be supported. Evidence that we can produce better equipped and more effective health professionals is desperately needed. So that concludes Chapter 4. If you have any questions, please let me know. Thank you.